So let's talk about management of infant born to mother requiring GBS prophylaxis. Group B, streptococcus prophylaxis. Okay, so how do you manage? So we give antibiotic prophylaxis, antibiotics. And what are the antibiotics that we use for prophylaxis? Ampicillin or cefazolin, and it should be administered 4 or more hour before delivery. More hour of delivery. And if it is administered 4 or more hour of delivery, then what will you do? Observation of infant for 48 hours in nursery. And if it is administered less than 4 hours before delivery, then we ask whether the gestation was 37 weeks or more, and rupture of membrane was less than 18 hours. Yes, then we observe only for 48 hours. Otherwise, do CBC, blood culture, and observation for 48 hours. Okay, so this is a chart. How do we manage an infant born to mother requiring GBS prophylaxis? Intrapartum antibiotic prophylaxis can prevent transmission of GBS, okay, to infant and minimize the risk of early onset sepsis. An indication for prophylaxis include maternal GBS bacteriuria, positive rectovaginal culture of GBS, obtained at 35 to 37 week period of gestation, or previous infant with invasive GBS disease. Previous infant with invasive GBS disease. A positive rectovaginal culture for GBS during previous pregnancy is not an indication for prophylaxis in subsequent pregnancy. So I am writing it again. A positive rectovaginal culture for GBS during previous pregnancy is not an indication for prophylaxis in subsequent pregnancy. Prophylaxis is considered adequate if administered 4 or more hours before delivery. Okay. Although mother receive ampicillin or any other cefazolin or any other antibiotics, prophylaxis is inadequate if it is given less than 4 or less hours before delivery. So it must be 4 or more hours to take the effect of antibiotics. Okay. And all infant born to GBS positive mother, and regardless of prophylaxis, should be observed in nursery for 48 hours to monitor for signs of infection. like lethargy, poor feeding, temperature instability. Infant whose mothers are not treated adequately. CBC and blood culture should be obtained only if infant is preterm or if there was prolonged rupture of membrane. So I am writing here it for you. In infant whose mother were not treated adequately, CBC and blood culture should be obtained only if infant is preterm, less than 37-week period of gestation, or if there was prolonged rupture of membranes, 18 or more hours. Okay, you should remember this. And newborn whose mother did not receive indicated GBS prophylaxis must be observed for 48 hours. A CBC with differential and blood culture are indicated if infant is preterm or was exposed to prolonged rupture of membranes. In addition to CBC and blood cultures, antibiotics are indicated if infant is ill appearing or born to mother with chorioamnionitis. Ill appearing infant should also undergo lumbar puncture for evaluation of meningitis. Okay, thank you.